the shocking statistic that kind of knocked my socks off was that when I looked at the research, it was something like, okay, and they play games with the wording, okay? They say delirium. 1 out of 10 after the age of 65 will have a bout of delirium that lasts around 3 months. So basically what we're saying is 1 out of 10 have a risk of developing dementia within a year of your anesthetic. If it's cardiac and open heart, it's 2 out of 10. That's 20% of the people going through open heart surgery will develop dementia in a year after their surgery. I don't know about you, but that was shocking to me.
What if aging isn't about slowing down, but leveling up? I'm Dr. Isaac Jones. This is the Longevity Leaders Podcast.
Welcome, everyone, to the Longevity Leaders Podcast. I'm your host, Dr. Rudy Mueller, and today we have our special guest, Sandra Bargeron. Sandy, give us a little bit of background on, your title and what you've been up to lately and what got you into where you are.
Well, thank you, Rudy, for having me. I am a double-boarded physician assistant, and I'm also a anesthetist, so certified anesthesiologist assistant. Those are different than CRNAs, but similar practice. And then I have a board certification as a natural medicine doctor, so I am a PhD in that as well. I just didn't want to stop going to school, so I just kept going, but did the long way instead of going to medical schools.
Yeah. Well, as many letters as you can collect.
That's a whole sentence.
That's awesome. So I know that one of the things as an anesthesiologist or working with anesthesia, we're looking at the effects of anesthesia long term. And you have a new book that's coming out here shortly, if you don't mind. I love the title.
Yeah, the title is Getting Over Going Under, which is self-explanatory. Most people understand when they hear that, they're like, oh, yeah, okay, I know what that's about, so I really like that title. Well, one thing I've heard a lot more in the holistic community than in the anesthetic world is that anesthesia is like a mini TBI. It's like a small traumatic brain injury. And to be really honest, it is kind of a chemical TBI. So what happens under anesthesia is that it's not that the anesthetic is necessarily the insult that is the thing that has altered your brain. It's that it unmasks the vulnerabilities that your brain already has. So if you know anything about the world today, there are a lot of neurologically vulnerable people between the autism community, the aging community, and even in perimenopause. Those are my 3 big groups of people who I feel have the highest vulnerability when they go through anesthesia. And so anesthesia really kind of unmasks that. Now, what does that mean? In the elderly population in anesthesia, we've really studied dementia as it relates to anesthesia. And there was this big study that came out, was a meta-analysis, which has its limitations. And recently it made headlines because it said, oh, there's no link to dementia and anesthesia. And that goes against everything we see in anesthesia. So, it's laughable. But the thing is that that's just dementia that they're looking at there. That's a very specific set of symptoms that fall into a category that you can make a diagnosis with. There's a whole host of symptoms that people have that don't meet the criteria for the diagnosis of dementia. That's cognitive dysfunction and life altering. I met a lady last night. That was her whole story, why she's a practitioner. She's had multiple anesthetics, and she said they ruined her life because she literally lost all cognitive function for a while. So, and that's a story I hear a lot when I mention my story and my book and what I'm doing. They're like, oh, yeah, I felt horrible for years after anesthesia. Now, that's not dementia, but it's life altering.
Sure. So what was the kind of eye-opening moment for you that really said, oh, you know what? I think there's a little bit more to uncover here with anesthesia and its effects on a person's life.
If you're a medical doctor, nurse practitioner, chiropractor, or other health expert that's stuck in a broken system, there's a better way. The Freedom Webinar shows you a proven 5-step system to build a 7-figure virtual health practice, or how to modernize your current brick and mortar practice without the burnout. Learn to create high-ticket programs, automated income, residual revenue, and attract clients ready to work with you. Book your $1 million strategy session today by clicking the link in the description.
That's a great question. So I fell into holistic health because my son, who is now 14 and he's thriving, He was 6 at the time. He started having weird neurologic symptoms, and he's number 3. So number 1 and 2 had the blessings or curses of my medical training. So they had all the medications and they had all the things, and both of them had all kinds of problems.
Mhm.
The oldest had ADHD, was medicated at 4.
Mm.
The second had pandas, which I didn't diagnose until after my training. I didn't understand what was going on with him. The third one, because of the oldest being on like, stimulants since he was 4, I was determined not to do that. So I resorted to kind of researching and ended up changing his diet. His ADHD symptoms improved, but his joint pain and his systemic pain started to be more obvious. And that was at 6. Now, this is a robust kid who wants to play outside, and he's complaining of muscle and joint pain when he comes back. I mean, debilitating when I'm laying on the couch. This is not what the kid wanted to do. He wanted to play. And so I started to go, okay, well, what else is going on? And interestingly enough, in the timeline, now looking back and after my research of anesthesia, I realized there was an event where it really got worse. And that was when he went under anesthesia. So he was already feeling kind of bad. And then he did like most 6, 7-year-olds do and decided to try out what the taste of a quarter was. Stuck it in his mouth and it got stuck in his esophagus. He had like a 8-minute anesthetic, but when he woke up, his immune system was shot. And it was after that he really spiraled. He'd be on the couch most days. And so we ended up with a environmental naturopathic doctor who diagnosed him with mold and Lyme. And then we attempted to treat it. Now, if anybody in the Lyme community understands what I'm talking about, we went to that doctor who wasn't a Lyme specialist, and he attempted to help and made things worse. So we were living in Georgia, Florida now, right? It's very moldy. I couldn't get on top of his immune system. So we ended up moving to Colorado in the middle of the pandemic and couldn't find a practitioner. So I ended up going back and doing my research, right? So I ended up doing my research, helping my son navigate Lyme, and he's now great. He's fencing and playing and amazing. He's doing great. He literally grew 2 feet. I swear it was 2 feet after he got better. It was insane. But in the midst of all that, I was in the operating room. I walked in one day and I opened the patient's chart. She had cancer and I was doing her anesthetic for cancer. And I opened the chart and I saw a genetic mutation that we often look for in holistic health, the methylation dysfunction. It was a methylation gene, but it was listed in her like diagnosis.
Interesting.
And I thought that was weird. And so I was like, okay, I know they test this in cancer, but why is it in her diagnosis? So I asked her about it and I asked her about her anesthesia experience. She hadn't had any issues. But I had this like crisis of conscience because I was like, okay, I know how bad this is for how well they're going to navigate toxic burdens and things like that. Today I'm going to change her anesthesia. So, the team and I talked about it and I altered her anesthetic for the day, which made me feel good, made her feel good. But ultimately, if anybody's gone through cancer, it's multiple surgeries, multiple toxic events, chemo, all of it. So I don't know how much it impacted in the long run, but it triggered me doing the research because then I was like, are we even talking about this in anesthesia? Like these cancer patients, they have all these hits. Do we need to do anything? Like, is there some research? And sure enough, in the anesthesia world, I opened it, I did the research and there was discussion about like, should we alter the anesthetic? Should we do something different? There's discussion, but there's not like recommendations because every anesthesia provider thinks that their way is the best way. And it is the best way for safety because ultimately in anesthesia, what we're trying to achieve is keep somebody safe and alive through a very uneven. It's like flying an airplane. Like you're gonna hit turbulence. It could be really bad. You can lose an engine. Like you want to live through your surgery.
Sure.
So we're very good at that. And also we don't want you awake, those things. Those are our primary goals. The secondary holistic mindset is just, there's some people who have that mindset, but it's not the priority. Priority is get you through safely. So my review of that, I took inventory of all that and I went, it wouldn't be fair to my colleagues to go over here and tell the whole public, oh, you tell your doctor to do anesthesia this way. That's not what we're trying to do. That's not fair to the anesthesia provider. It's not fair to the patient because then honestly, if your anesthesia provider is not happy with the plan and he's not comfortable with it, he's not going to do as well,
Mm.
right?
Yeah, of course.
So, um, I was like, what can I do to advocate for these patients? And so that's what led me down the road of of writing the book. So long story, long backstory, but
Yeah,
that's
but
where it came
those
from.
are big milestones for you to be able to come to this realization. And I think, if I would liken it to another thing in the medical industry that's a problem is we give antibiotics, and the antibiotics are necessary, most of the
Right.
time. They're going to save a life. They're going to help improve a person's quality of life in that given moment. But do we talk about probiotics? And I think we're starting to see more of that in the traditional medical system, or even with medications, taking a metformin, and does it cause a nutrient depletion? So now we're just saying, okay, yes, anesthesia is an important piece,
Right.
especially if you need that surgery.
Heck yes.
So really what
And
it
you
comes
want it
down to
safe.
is, but realize that it's going to have some sort of an effect on the body, on your
Right.
system. And so I'm curious, you mentioned, obviously cognitive
Mhm.
issues. Are there any particular signs or symptoms for a person that's listening, whether they're thinking of a patient or a client that's gone through anesthesia, or they themselves have gone through it? Anything that would say, this is an important piece maybe in my timeline. Any other symptoms there besides?
So yeah, so great question. So I would say the shocking statistic that kind of knocked my socks off, so and then I'll answer your question more directly, was that when I looked at the research, it was something like, okay, and they play games with the wording, okay? They say delirium. 1 out of 10 after the age of 65 will have a bout of delirium that lasts around 3 months. What does delirium do? And if we take the next step, delirium is associated with increased risk of dementia. So, okay, so basically what we're saying is 1 out of 10 have a risk of developing dementia within a year of your anesthetic. If it's cardiac and open heart, it's 2 out of 10. That's 20% of the people going through open heart surgery will develop dementia in a year after their surgery. That's I don't know about you, but that was shocking to me. I was like and honestly, then I looked back and I thought about my mother-in-law, and she was a vibrant, having some brain fog, having some, she called them brain farts, 62 years old, and then her sister had a cardiac event, and my father-in-law, who was a orthopedic surgeon, older guy, okay, was like, "Oh, well, we have to do stents, and we have to go check your we have to make sure you're okay." Sure enough, they do a cath. She's got, like, multiple blockages. They put her through bypass surgery, and she was never the same. She died at 79 of dementia. So, it's very personal to me because I now looking back with the information I just gained in the last few years because of the patient who had cancer, I went, "Oh my gosh, this has touched me in every way," So, it's a big deal, and then those are the obvious ones. I would say that women are at a higher risk than men because of the impacts of the loss of estrogen on the brain and the loss of volume that we have in our brain. We're just naturally a little bit more vulnerable to the impacts of anesthesia than men are. And then you have the autism community, the neurodivergent community. I have heard this more than I can count, and it is well understood in the autism community that when a child who has autism undergoes anesthesia, they always experience regression. I remember I was trying to get some funding because I'm also trying to create a product to target the anesthetic and clear it. And I was talking to the bank, the loan officer at the bank, I guess, whoever that person is. And she says, "My son has autism. I want to know about your book and I want this product." And I was like, she says, "Every time he goes in, I swear he's regressed 2 years in the last few anesthetics he had." So I was just like, I hear this more than you can imagine. And then that's those are the 2 biggies. And then the shocking one is, that perimenopausal woman, progesterone has declined. We don't detox as well. We still have our estrogen, but it's going all over the place. And so we're already developing some brain fog. We're already developing some fatigue. And then get a major toxic event like anesthesia. It's not just the toxins, it's the stress. It's a hugely stressful event. I tell people it's not just the chemistry. If we're thinking holistically, we're thinking mind, body, and spirit. Okay. Well, under anesthesia, we literally turn off consciousness, but your body's still perceiving stress. So, though you don't know that you are having your appendix cut out, your body knows it. And then when you wake back and bring that cognitive function back online, now the body has to do this integration process of connecting what the body experienced with the mind. And sometimes that's easy and smooth, and sometimes not so much. Think about your TBI patients, your PTSD patients. They already have this fragmentation that's happened. They really struggle with that reintegration, and that can last for a while. And I honestly think that has a little bit to do with that medical PTSD people develop.
Yeah.
So sorry, and I didn't quite answer your
No, yeah,
question
yeah, you
very
did. I mean,
directly, but you gave me a standpoint.
I think what I'm getting from it is that, when we're talking about anesthesia, and it makes complete sense that its main effect is to shut down the neurological system from being able to perceive pain and put you
Mhm,
out, right? So
mhm.
it makes complete sense that it's going to affect your neurological system. And
Correct.
then really what I'm hearing you say is that it's not necessarily the sole cause. They're definitely, but it is a contributing factor that we need
Correct.
to be paying attention to.
Yeah.
And then for people that are having symptoms after anesthesia, they tend to lean towards neurological
Correct.
issues, fatigue, delirium, et cetera,
Fatigue,
depending on
delirium, yeah.
age, right?
Some people, definitely the people who have significant methylation dysfunctions, those people, I have one client who I've seen for Lyme, who I ended up doing her anesthesia because she had to have a surgery. And I mean, I knew all her risks. I was like, oh, geez, like every anesthetic she ever had, she was rehospitalized for nausea and vomiting, like severe. Well, she had like all kinds of methylation problems, all kinds. And so, I knew that going into her surgery, and I had her very well prepared. And I did her anesthesia, so I know I did a lot of things that were very targeted, keeping all that in mind. And even with that, she still had pretty significant nausea, but not I wasn't rehospitalized. So that was a big one for me. Like, she didn't actually have to come back to the hospital for throwing up and things like that. And surprisingly, I mean, honestly, given her vulnerabilities, she had a lot of them. She had Lyme for 15 years. So her nervous system was a disaster. She actually navigated it pretty well. I mean, I did both her anesthesia and her holistic preparation, so it's kind of a unique situation,
So it's really understanding the terrain as well. And then obviously the
yeah.
genetic predispositions around methylation.
Correct.
And that's
Yeah.
due to the detoxification
Correct.
pathways. Okay.
And then also, are your hormones imbalanced?
Right. Yeah, of course.
Because those affect your detoxification as well. So she also was perimenopausal, so she was like the worst of the worst of the worst possibilities, like Lyme, methylation problems, perimenopausal. I mean, we had, supported her hormones and started to bring them online before going into surgery, but it was a complex situation and a very good experience to be able to do both sides of the thing. A
Yeah.
very unique opportunity for me.
So, I mean, naturally, this brings me to a question of, okay, as a practitioner, are there screening tools that are current that can be utilized pre and post anesthesia to see the effects? So that would be my first question. And then my second question is, okay, we've gone through anesthesia, we're having symptoms. What's the path to getting recovered and clearing those particular
Excellent question.
toxins?
Such a great question. So actually, it was in writing my book that I had to do so much research and look at all the literature. I had to be very, very careful to make sure I was being honest with the literature and then also being honest with what patients experience because they don't always match. And what I noticed, especially like that recent meta-analysis that said, oh, there's no connection between anesthesia and dementia, that anybody whose mom or I mean, you just scroll through Dr. Love's TikTok on that subject, and you'll be like, "Yes, my mom died of dementia. Yes, right after surgery. Yes." I mean, there's so many people. It's obviously impacting people's bodies, so it's a lie. But going through that research, I realized in the studies the limitations was this: when they went and looked at whether there's a relationship between anesthesia and dementia, what they did was they looked backwards. A lot of times they took these patients who they knew had surgery. They knew they had the label of dementia, meaning an ICD-9 code that met all these criteria. And then they looked backwards and they went, okay, did they have anesthesia? Okay, cool. But then they also didn't define what kind of anesthesia, which is another variable that's ridiculous. But only a handful of studies would actually control for, let's do a preoperative cognitive assessment based on standardized cognitive assessments. And
Like a
then,
MOCA?
like a MOCA,
Yeah,
yeah.
okay.
And that's pretty much the standard was the
Yeah,
MOCA.
which is poor.
Exactly. Exactly. So they would do that, and then they would take them through anesthesia and then track them for a while and see, okay, so there are very few studies that did that, and that made me go, "Light bulb, well, what if we actually let people have a tool where they can assess their own cognitive function and track it on their own? It's not gonna be something we're gonna integrate into anesthesia or preoperative testing. I mean, we can barely get a cardiologist to properly clear a patient, so, we don't need to add another layer of stress. So I was like, "Okay, I'm gonna create the tool." So I did. I can't believe I said I sat there and I worked with a coding generating thing to create a neurocognitive assessment that took in Mocha and a couple other tools and integrated into a online platform, which does have limitations. If my sister's a neuropsychologist, she would go, "Ugh, it can't really assess somebody online." And she's correct. The goal is to have a screening tool to track, it's not going to be perfect, but it weighs their results from that exam against the anesthetic type, the gender, and their pre-existing conditions, and it gives them a score. And the goal is that's online. So that's going to be available when the book comes out. All those resources will be available. You can assess your own score. And then afterwards, the goal is to track it. So at certain intervals, maybe 1 week, 1 month, 3 months, and 6 months, you track your own neurocognitive score. And did it go down? Did it go back up? Those type of things. And the goal for that is, one, it's an empowerment to the patient. It's validating. A lot of them, like, they feel like they've lost their mind, but when you've lost your mind, like, the world isn't right. You're perceiving the world incorrectly, right? So it's an empowerment tool. But for me, ultimately, as a practitioner, I want to also fill in that gap where the studies are poor. Like, we don't actually have objective measurements pre and post. So that will provide some of that research
Sure.
piece for us. So that's one. And then anesthesia, the actual medications are not like other toxins. Okay, they're halides. So they don't interact with the body the same. You don't chelate them the same. You don't detox them the same. That they like to kind of, everybody likes to tell me that they oh no, they're excreted. I'm like, no, they don't. They're not excreted. They like to hang out in the fat loving areas of the body. So the bone marrow, I mean, low grade, it's not like it's like saturating the bone marrow to the point of suppressing its function or anything like that. But if fat cells and bone marrow kind of hangs out there, especially if there's situations like low iodine where the body can't move those things out. And so it'll hang out there. And so my goal was to create a product that's targeted toward anesthetic clearance. And what I mean by that is the gaseous halides. Okay. The older anesthetics contained bromine, chlorine, and fluorine. The current anesthetics contain chlorine and fluorine. So we're talking about fluoride gases. So heavy, high dose fluoride gases. So the goal was to create a product that targets that. And I did formulate it. It's in R&D right now. So I've got a lot of things coming out,
Yeah,
like a lot of
absolutely. That's great.
resources. Yeah.
So, I mean, the product, obviously, iodine is in that same category. So it would help with the detoxification, correct? Am I thinking wrong with that?
So you're not thinking wrong. If
Okay.
you look at the periodic table, and since I'm talking to doctors, I'll say that, if you look at the periodic chart, you got, let's see, it goes iodine at the bottom, then it's bromine, chlorine, and fluorine. If you go upward on that column of the periodic table, that goes up in reactivity. So that means the fluorine is the highest reactive, and it's going to displace everything below it, right? Chlorine is going to displace everything below it, and so forth. You get the point. So if you have low iodine already and you introduce fluorine, fluoride toothpaste, whatever, it's going to displace whatever iodine you do
Right.
have, which is then what do you think causes Hashimoto's?
Right.
So, is that a component? Yes, absolutely. Is brominated bromine in our bread a problem? Yes. That's for the same reason. Now, do we just give iodine? That's the
Well,
question I
no,
get a
yeah,
lot.
that's a tough one.
That's the question I get a lot from people. They're like, "Oh, I just need to give iodine." I'm like, "Have you looked at your population recently? That's not a great idea." Now, I do recommend it in my book, and I recommend it with the caveat of, I know everybody says iodine's going to cause Hashimoto's. It's not. It's not the cause of your Hashimoto's. if you do have Hashimoto's or autoimmune thyroiditis or something like that, you're going to need to have care and be careful with iodine. That's why it's not in my product. I will have an iodine, a boost product that contains some iodine natural sources, but it's not in the standard detox product because I don't want that
Sure.
interaction
Yeah, it
with
makes
people.
complete sense. So when is the actual official launch of the book, and where can we pick it up?
Great question. It is launching first quarter 2026, and I'm sorry to be vague, that's what my editors are have told me, first quarter 2026. It's in editing, and because it's so heavily cited, the book is so heavily cited, it has to go through a lot of edits,
Sure.
just to be scientifically,
So getting over,
integrity. Getting over, going under.
going under. Love it.
The first guide to holistic anesthesia.
Awesome. Well, thank you so much, Sandy. I appreciate your time and all of the work that you're doing. I can see that, anesthesia is an insult. And if a person has the wrong terrain or, phenotype that could potentially worsen their condition, what you're doing is really going to open eyes to not only the patients, but the practitioners that are seeing it every day. So I
Absolutely.
appreciate all of your work. Thank you.
Yeah, thank you. Thanks for having me. Let me
Absolutely.
talk about the thing I love.
Yeah, for sure.
Thanks for listening to the Longevity Leaders podcast. Our Longevity Leaders community is on mission to transform 100 million lives by 2040. If you enjoyed this show, please share this with somebody that you know, especially another doctor or physician, but also click that follow button. Until next time, stay strong and live long.